And we can start. I already mentioned that my name is Misha Seles, psychiatrist with All My Moods and the program director of the festival, which tonight is already 1 week. We're into the festival, and I will be your host this evening for the lecture with Nils Fietje from Copenhagen. Welcome, Nils. I really like the city you're coming from. It's a really family-friendly city with a lot of coffee, a lot of design, very family-friendly. And you have a PhD in medical history, I learned. And the lecture tonight is mentioned, can you dance your way to mental health? But your perspective will be a little broader. You're a research officer at the World Health Organization in Europe, and you're doing research on all kinds of arts, for instance, music, but also dance, also singing, as interventions on health, mental health, also physical health, not only as treatment, but also as preventive measures. Welcome, really interesting. At Oh My Mood, we like the holistic approach and the preventive approach of health. We're really curious what you're going to tell us. Are you ready, Niels? You have to unmute yourself. Yeah.
There we go. That's always the sign of a beginner when it comes to presentations on Zoom. So yeah, I just wanted to say thank you very much for the opportunity to present to you today. I think I will be doing something slightly, perhaps slightly different. I don't know how many people of your general kind of group of people who come to the event will know about arts and health and will have participated or be aware of arts and health kind of intervention. So I hope what I will be saying will kind of be novel and of interest to some of you. And I should also say that I'd be more than happy to pick up any questions either during the presentation or afterwards if you share the slides or whatever you might do. I'm very keen to reach out and to hear what people think about this this topic. So I will attempt to share my screen now and get going with the presentation. There we go. Can I just make sure that you can see what I have written?
Yes, I can
on my
see
screen.
it. Yes, it's okay. Yeah.
Perfect. So as I was saying, my name is Nils Fietje, and I work in WHO Europe at the European Regional Headquarters. And my day job is actually in the Behavioral and Cultural Insights Unit at WHO Europe, where we do a whole range of activities. And the work on arts and health is actually relatively small comparatively, and certainly very, very new. So we haven't been doing this for very long, and I'll say a little bit about why we're doing it, and also where we are, what we've recently done, and a little bit about some of the kind of policy implications of the work that we're doing in relation to arts and health. Finally, I'll say a little bit about what the future might hold and where we hopefully might see ourselves evolving to. So let me see. What is arts and health? That's perhaps the first question that would be useful to tackle. Long before humans knew about penicillin or genetics, they created music and art. And our need to express our hopes and fears and to create meaning from our surroundings and to share these these thoughts through artistic creations with others is as profound as our need to quench our thirst or to still our hunger. So given that, should we really be surprised that art can improve health? Should we be surprised that art can promote our well-being? The famous French painter and sculptor Georges Braque once summarized the relationship between the arts and health in a way that only an artist can. And that's the quote that you see in front of you. Art is a wound turned into light. So what is arts and health? Very simply speaking, arts and health covers a range of activities that could be things like singing in a choir to improve chronic obstructive pulmonary disease, or going to a music group to improve or reduce symptoms of postnatal depression. Anything that's considered a non-invasive, low-risk treatment option, and that are increasingly being used particularly in Western countries to supplement more traditional biomedical treatments. And so I want to give a quick anecdote about how this became something that I became aware of, and why it became something that I became very interested in. A few years ago, my mother, who's in her 70s, fell and broke her hip, and as probably many of you know, that's quite a substantial accident when you're in your 70s. Now, my mom ended up getting a hip replacement operation. Everything worked out very well. The surgeon was highly skilled, and I'm very glad, of course, for the advances in scientific medicine that managed to get my mother back on her feet very quickly. But we soon realized that a much more profound problem had started to evolve, and that was that my mother's lack of ability to move, her fear about the consequences of her fall, her uncertainty about her sense of balance, they all had a very profound mental health impact on my mother. And the biggest challenge really wasn't the physical recovery, it was the recovery that helped her get back to her previous state of mental health and well-being. And we didn't have access to arts and health interventions at the time, but somebody mentioned to me that in a similar case with their parent had ended up going to a dance class specifically tailored towards rehabilitation and specifically set up to help with recovery from post-operative hip surgery. And then that class had not only helped their parents to physically recover, but had done a fantastic job at helping with bringing a certain sense of confidence back to the individual. And so that's when I started looking into arts and health as a field, and started inquiring about the evidence base around arts and health. And I was really quite surprised to find that the field was mature, that there was a huge amount of evidence ranging from perhaps more qualitative evidence, but all the way to randomized clinical trials, to the really kind of hard evidence that WHO predominantly is interested in. And so at WHO, we started to think, well, maybe we should have a look at this a little bit more seriously, and commission a report on the evidence base for arts and health. So that's what we did. And we published this report in the end of 2019, where we basically asked the questions: what is the evidence on the role of arts in improving health and well-being? Now, this report is a substantial piece of academic work. It brings together hundreds of publications that are that illustrate the positive effects that arts interventions can have on a range of health challenges across the life course and throughout the continuum of care. And the report shows us just how the arts can tackle these kind of wicked or complex health challenges like diabetes, obesity, mental ill health, and how they can offer solutions that common medical practice has so far been unable to address effectively, or at the very least how they can complement the kind of arsenal of options at our disposal. Now, the report covers a range of activities loosely categorized as arts, including performing arts, visual arts, including design and craft, literature, culture, online, digital, and electronic arts, etc. It leaves out a few components, and that's because we didn't have the space or the time to look at things like architecture, for instance, and health, which is a very large area of research where there's really very good evidence for the effectiveness or the importance of architecture on health. But because it's such a big topic, we felt we probably needed a separate report to look at that, which is something we'll hopefully be able to do in the future. The report really comes out strongly in favor of the implementation of arts interventions for which there's a strong evidence base. So the important thing to say here is that we're by no means trying to make claims for the arts and health generically, that every single art intervention is going to have quantifiable and evidence-based impact. That's a type of statement that, of course, we wouldn't be able to make for arts and health any more than we can categorically make it for biomedical medicine. But we do recognize within the publication that there are a number of arts and health interventions that have really very good evidence, and that health systems and governments and hospitals should really begin to look at and acknowledge in order to become aware of the potential of arts and health. Another important aspect of the report was the fact that we wanted to create a platform where we could share with countries knowledge and practice from effective interventions and case studies. So the report has a number of case studies within it that helps to kind of elucidate how arts and health interventions work and how they've been integrated into health systems across the European region. And finally, I think one of the important outcomes of the report is to say that, you know, we talk a lot in the policy arena, we talk a lot about cross-sectoral engagement, but practically speaking, there's not really that much that happens in that realm, and if it happens, it tends to be between kind of health and education, or maybe health and finance. But it really reaches other sectors. And so this is an attempt to kind of show how two sectors, the arts and cultural sector and the health sector, can cooperate and collaborate, and how arts and cultural organizations can make health and well-being an integral part of their strategic aims and the strategic aims of their work. So apologies for the title here. The title, unfortunately, is a leftover from somewhere else. But this is just to kind of give you a little bit of a sense of what the report looks at, the kind of different areas that it focuses on. So it looks, as I was saying, it looks across the entire life course. And it looks at prevention and promotion, as well as management and treatment of ill health. So it says that within the report, we make the claim that the arts can affect the social determinants of health, like developing social cohesion and reducing social inequalities and inequities. It can support child development, like for instance, enhancing mother-infant bonding and supporting speech and language acquisition. It can encourage health-promoting behaviors through promoting healthy living or encouraging engagement with healthcare. Arts and health can help to prevent ill health, including enhancing well-being and reducing the impact of trauma or the risk of cognitive decline. And it can support caregiving. That's also a really important component of arts and health, including enhancing our understanding of health and improving clinical skills. In terms of management and treatment, the report outlines how the arts can help people experiencing mental illness at all stages of the life course, for instance, by supporting recovery from perinatal mental illness and after trauma and abuse. It can support care for people with acute conditions, for instance, by improving the experience of and outcomes in care for hospitals and patients. And it can have important effects on neurological disorders, on non-communicable diseases, and vitally also on end-of-life care, including palliative care and bereavement. So finally, I want to end on this slide before I try to show a short film in which we give the voice to one of the people who have benefited from an arts and health intervention. And this slide is really supposed to illustrate how we at WHO hope that arts and health might be integrated into some policies that member states might want to think of developing. So acknowledging the growing evidence base for the role of arts in improving health and well-being, we want the evidence to lead member states to support the implementation of arts interventions for which there's a strong evidence base. And this could include, for instance, the use of recorded music for patients prior to surgery, for which there's incredibly strong evidence. I mean, and if you think about that, that's an incredibly easy intervention to actuate. It just requires that people are aware of the fact that listening to music before you enter into the operating theater has quantifiable health effects. Mm. We want to share with other countries the knowledge and practice from effective interventions and case studies that have used the arts to promote health, improve health behaviors, or address health inequalities and inequities. There's really a wealth of activity that goes on in the arts and health field, but I'm not the only one who was surprised to learn about it a few years ago. Arts and health has been around as a field for probably over 40 years, but it's still relatively niche, and people are working on these topics very much in isolation. And we hope that the report and also WHO in general can provide a platform for that knowledge and that knowledge sharing to come together. And we also want to support research in the arts and health, particularly focusing on policy relevant areas like studies scaling up interventions to larger populations, or exploring the feasibility and acceptability and suitability of new arts interventions. That's obviously a huge component of this, is to try and encourage not just research, but also research translation. So to try and generate more and new arts interventions on the ground. Now, recognizing the added health value of engagement with the arts, we want member states to ensure that culturally diverse forms of art are available and accessible to a range of different groups across the life course, especially those from disadvantaged minorities. Again, the report very much goes to show that arts can be an equalizer, and we go out of our way to explain that when we talk about art, we're not talking about high art, some kind of exclusive club, but that we're talking about art in the most visceral, most organic of forms. the report encourages arts and cultural organizations to make health and well-being an integral and strategic part of their work. And I think that's something that we're really keen to get arts institutions to become aware of, that they really can play a role in promoting public health. And also we want to develop interventions that encourage arts engagement to support healthy lifestyles. So again, the idea that effective arts and health interventions can actually also be vital in health promotion. And then finally, noting the cross-sectoral nature of the arts and health field, we want to work with member states to strengthen structures and mechanisms for collaboration between the culture and social care and health sectors, such as introducing programs that are co-financed both by arts, health, and social care budgets, so that it's not just the arts sector or the artists who are solely responsible for this work, as is mainly the case now, but that it's really a collaborative enterprise. We want to develop stronger lines of referral from health and social care to community arts programs, for instance, through the use of social prescribing schemes. And again, that's something that's being trialed in a few member states, like for instance in Sweden and the UK, where so-called link workers are being employed to enable general physicians to connect patients with relevant arts and health programs. And we also want the arts to be something that is more systematically included in teaching, for instance, of medical students, and so to support the inclusion of arts and humanities within the training of healthcare professionals more broadly. So I've talked for quite a while here. I hope we can get a discussion going. Before I show the video, I just want to say that of course our job is not done at all, and many exciting challenges remain. There's further research that is needed to understand the health effects of particular arts interventions. More funding is needed to roll out and evaluate arts interventions at scale and across countries. And a better understanding of the health economics of arts interventions is also still needed if we're going to mainstream arts and health. Nevertheless, I'm confident that the report that we published will allow us to change into a higher gear and to accelerate research and policy development in this area, and to see arts and health interventions for what they are: creative solutions for complex challenges. So I'm just gonna see and hope and pray that I can show this video, and then I'll be happy to have a discussion, Misha.
That's great.
Let me know if there's any issues.
Yes. It's not showing yet.
Oh, it's not? Okay.
No, it's not showing yet. No.
Ah, okay, it's showing on my screen. Well, let me try one more time. I might have to unshare my stop sharing and then share again. So just bear with me as I try this one more time.
Yes.
Perfect. Can you see it now? And
when
you
Cara was
hear
born, it was just an overwhelming sense of isolation. It was just relentless, the lack of sleep and kind of feeling very out of control, and it can get very dark and very depressing. You need to demonstrate to them how they should be. So I wanted to really relearn to love myself and relearn to be a better person, so that she can grow up seeing that I love myself, which I didn't before. I'm Charlotte. I've suffered from some postnatal depression recently, and I have a 7.5-month-old baby. So from the age of 30, like, I've had some very severe dips into depression and anxiety, culminating in one very bad attempt at suicide, which I'm not proud of, but it happened, and I wanted to move forward from that and never go back there. So I've worked very hard just recently with psychotherapists and with counselling to really combat the depression, which can just make you feel so worthless and useless, which as a parent you can't feel like that. You really need to be strong for your baby. So the depression, really, like, now I want to fight it to keep it away.
My name's Cleo, and I run Melodies for Mums, which is a singing group specifically for women who suffer from postnatal depression. The main thing is that they're not being so isolated, and they're realising that they're not on their own. They're not the only ones that are going through these different challenges.
We didn't really need to talk about, you know, the depressing kind of facts that we were all struggling. We just had this wonderful positive experience at the other end. And we sound really good. We sound amazing, which was one of the revelations that lots of beginner singers, and it's just so uplifting. But they're real community songs about happiness and joy, and I feel that when I sing them. I feel really special and really good. And I'm just really glad that I went there and have tried to find different things that made me feel really good. And it's brought me and Cara closer. We're able to laugh and sing, and we have much more happy moments. And I can't say specifically that it's Melodies for Mums, but it's the feeling of that was one of the first places where I started to really enjoy spending time with my baby and doing things for us together. And that's been something that I will take with me from the class and forever.
There we go. I hope you had sound, because I didn't.
Yeah, I was really, really touched by the video, Nils, as a mother of 3 children, which already opens the heart, you know, as a young father. And as a psychiatrist, it's also a special part, the parents and the children. And there's a lot of suffering when they come to healthcare. And so sometimes it's so little you can do. And I was really touched because it's such a positive and such connecting experience, which is really different than only seeing disease, treatment. So it's not only, I was also really touched about what you shared about your mother, that the problem was not just curing from the hip fracture, but after that, there is the healing and becoming the old person again.
Yeah.
And I think especially in psychiatry, there is more awareness of the cure part and then the healing part. But we need more awareness of things we can do, healing the whole person. And I don't know if you know something about it. I worked as a doctor in Zambia, Malawi, and in Tanzania. And there is much more community and much more singing together and much more dancing together as a way of living. And it's always a really uplifting experience for me. And I also think it's preventing problems. And I think that's something we is at risk in modern society because of everybody working hard behind screens, the digital world, the competition, the stress. Do you know something about that?
So, I mean, I think you touch on a really important point there. I don't want to romanticize the kind of notion that in other, let's say, non-Western societies, where there might still be a more holistic connection to the body and the mind, that is better or not better. But I think something that in Western societies I would say have probably stepped away from, or rather started to have begun to ignore a little bit is the fact that the magic bullet myth of biomedical healthcare isn't going to solve all our problems, possibly not even any of our really big problems. I think we see that, for instance, at the moment with COVID, where a huge amount of hope is being placed in the vaccine, and rightly so. It's going to be an enormous achievement. It's going to it will have an important global impact. But I think it's premature to assume that all of the challenges, the COVID-related challenges, are going to be eliminated with the vaccine, and that everything will go back to normal the day the vaccine is deployed. And I think we have a tendency to really kind of buy into those narratives in the West. And I think the arts and health, good arts and health initiatives, good arts and health interventions don't start from the perspective that they are going to solve every problem, but they start from the perspective that they contribute towards a whole range of factors, including physical factors like singing for COPD helps lung capacity, helps lung functioning. It actually has symptomatic kind of effects. But beyond that, it also builds community. It builds confidence. It integrates people into, it gives people new experiences. Sometimes it gives people hope. It does all sorts of incredibly important human things that are very difficult to quantify and are very difficult to measure, but are nevertheless incredibly important in the healing process. And like I say, I don't want to sound too romanticized about any of these things. I'm going to be one of the first people to go out and get a vaccine when I can. But there are a huge amount of challenges that COVID-19 has unleashed that are not going to be solved by that one vaccine.
No, and that's in the scientific modern medicine focuses very much on the one or the multiple scientific interventions you can do. But sometimes we forget that people are nature, and we really need to connect with other people. And when you focus in healthcare only on the best scientific proven intervention without making room for human relationships, there is a lot of evidence that the doctor-patient relationship, when it's a warm and safe relationship, is a big part of healing. And So I think it's the whole package. And we must not forget that we are whole people, and we need to be a part of a bigger concept. That's the basis of our life. And because of your experiences with the arts as interventions, you actually see positive effects, and you add something to healthcare, and also as a preventive measure, but also as building awareness that we need more than only the biomedical model. So I think that's really, maybe the awareness is very, very important of the work you're doing.
Yeah, and I think at the same time, I mean, you mentioned evidence and the challenge of the kind of evidence pyramid, you know, from kind of the gold standard RCT trials to, you know, the word you may not mention, which is anecdote, you know, which and everything in between, and I think. Again, I understand the criteria, and I understand the usefulness of some of the thinking behind it. But at the same time, because of that evidence period, and because of the kind of insistence on certain types of methodologies and methods, certain things like arts and health have a very kind of tough time breaking through and being acknowledged and being given a chance. And that's a very particular thing for the health arena. Again, I understand where it comes from. You know, these principles were designed in order to make sure that drugs are safe, right? That things that interventions that have the potential to kill us don't, or maim us, don't do that. So that's very important. But in the case of arts and health interventions, in many cases, if not in most cases, the risks are pretty much negligible. You know, the risks of trialing an arts and health interventions is not even remotely comparable to the risk of a poorly researched drug. And I think that's something that is difficult to communicate in the biomedical sphere. And so you see, for instance, in the development world, where a lot of activity around sports and integration, for instance, is par for the course. I mean, it's something that you see a lot of money being invested in, a lot of confidence being invested in, a lot of people kind of trusting and believing that you can build bridges through football, or you can, you know, engage children and break down hostilities through other types of sports. That's accepted in many development programs, without an RCT to prove to you that it's effective or that it works. Now, of course, I'm absolutely in favor of evaluation and being systematic, and making sure that you spend money wisely, and you spend it as much as you can on things that you can show to work. But some of the criteria that we apply in the arts and health world just isn't fit for purpose, I think.
Yeah, and I think you have to when people talk about evidence-based medicine, they do not always understand that evidence-based medicine is based on the best available evidence in a larger context. So when you say you can only do interventions that are, when it's something evidence-based, it's always, I think that the real scientist is always actively looking for his hypothesis not being right. So you have to understand the value. And I think the purpose of psychological treatment, psychotherapeutical treatment, it's always about the integration of the person. So the integration of the body, the mind and the soul, the consciousness and the unconsciousness. And that's what you see. I'm also a yoga teacher, and yoga philosophy that's thousands of years old. Then it's also about integration with nature.
Yeah.
And but what we do with healthcare is we split people actively and consciously in parts. And I always think that people with a hip fracture are best off in healthcare because it's simplistic, materialistic part. But even then you say, my mother needed more than only surgery for the hip to heal again. I think that's even more so with complex patients, with patients with symptoms we cannot understand. And then evidence is scarce and doctors don't know what to do. Patients suffer. And then these more universal interventions can be really helpful. Do you do something yourself with regard to the arts? Are you singing? Are you dancing?
I'm not actually. No, I'm not a very artistic person at all. I do some sports, but and this is perhaps quite an interesting point to make. One of the things that arts and health interventions are quite remarkable at is patient retention. So actually keep getting people to come back. And so people like myself who are not particularly artistically inclined, who can't sing for the life of them, who couldn't paint their way out of a box, nevertheless get convinced to participate in a art therapy program for mental health, or in a singing program to improve their lung capacity, and end up staying, end up continuing to participate. So I think, again, often a misconception about arts and health is that it's only for the people who are already bought in, and only for the people who have an artistic tendency or have a desire to sing or have done so before, when in fact the research shows that obviously you need a certain open-mindedness, but sometimes all that requires is just to be told, this is available, and give it a try. There's something profoundly connecting about the arts if done well, and participation in the arts. I think is a universal need. I mean, one of the things I didn't really talk about in the presentation is that our report does talk about the active versus passive dimension of arts and health. So I've been focusing more about talking about the active participation in art, so singing or dancing, or even going to a museum to improve cognitive functioning. But there are many examples, like the one that I mentioned in the operating theater, of passive engagement with the arts, whether you're reading a book or watching a film or listening to music, and how those passive participatory arts engagements also have health effects, and in ways that, again, can be quantified if that's what we want to do, in a way that can be shown in a clinical trial to have meaningful effects.
Do you know, with your PhD in medical history, if it was more usual in previous ages to heal people with music, dance, other arts?
I didn't look at that myself. My history, my PhD research was more contemporary. But I think it's fair to say that the division between medicine and the arts is something relatively recent. I mean, shamanism and even even in today's kind of world of healing or healers in other cultures, the division is much more blurred. And in fact, in English at least, there has always been a connection in the sense of the phrase "the art of health," "the art of medicine." There's always been a sense about medicine being more than just a science, and certainly in the kind of educational trajectory of doctors, in the kind of 1700s and before, a very large component of their education, if not the dominant component of their education, would have been in the humanities. Greek texts, classical reading, etc. It was a fundamental component of their education. Again, I don't want in any way be seen to say that I wish doctors were to study English literature rather than physics or biochemistry, but I am saying that, and I think our report backs this up, that those doctors who have the opportunity as part of their medical education to engage in humanistic research or to be exposed to humanities-based subjects benefit from that kind of education.
I always think being a doctor is first and foremost being another human being, and the more integrated, rich human being with your own wounds and your own art making light, the more you have to offer another human being who is suffering. You also mentioned architecture, and I know from my background, we talk about healing environments in the hospital with more daylight and more nature. Do you mean the same thing, or is it a separate architectural part you refer to?
Yeah, I mean, I think that's the classical sense of how architecture and how basic kind of architectural design has a important and profound impact on health and recovery. So there's famous studies that from some time ago that show that people who are recovering in a hospital bed that is looking out of a window tend to recover faster and more effectively than people who are recovering while only looking at a brick wall or not having access to anything stimulating. So those kind of design choices are meaningful and important. But again, taken to another level, there are projects, for instance, in Denmark. There's a new hospital that's being designed in the north of Zealand, which is intended to really question and reconceptualize the hospital as a space whereby the hospital is not just a place that you come to where you're sick, but ideally becomes a place that you might want to go to as a family to almost like a community center where there's art on display, where there's a nice restaurant, where there are things happening beyond just this kind of central focus on illness. And so in the creation of this hospital, they've actually engaged a museum director to co-create the space and to try and think of the hospital space as much as a gallery, as a place for people who have health issues.
Yeah, that must have a positive effect on the feeling of people who are actually ill in the hospital. I sometimes read on social media, I think in Scotland, something about general practitioners prescribing nature, and maybe in Scandinavia, doctors prescribing a visit to the museum. I don't know, it's something I remember. Do you know something about it? And do you think we have to prescribe arts as doctors?
Yeah, so in the UK, I don't know about Scotland specifically, but in the UK generally, a so-called arts on prescription, or rather social prescribing, I think is what it's called in the UK, is something that is being rolled out throughout the NHS, and that basically constitutes that constitutes the creation of a new type of role, a social worker type of role called a link worker, who's familiar with the arts and not just the arts, but also sports activities and arts activities and and perhaps nature activities in a particular area, and whom the doctor can refer a patient to, whom the doctor thinks might benefit from that type of activity. I think this is still in the relatively early stages, so you know, you have to think also, you have to think about the fact that you need an infrastructure, obviously, of these types of interventions to be available readily, and you have to fund them, and you have to train people to learn about them, etc. So it's a complex undertaking, but that's the kind of mechanism that's beginning to evolve to try and get patients or the people who might benefit from those activities to actually get access to them, and ideally, obviously, through universal healthcare to get access to them for free, so that there's no barrier in the way. And in Scandinavia, in Sweden, there's a similar initiative in a region in Sweden called Skåne, which in this case is actually called Culture and Prescription, where doctors can refer patients to participate in certain arts interventions, but also to do things like, I believe I'm right in saying, to do things like have to go to the theater, or to have certain arts activities be subsidized as part of their healthcare right to healthcare. So these things are beginning to happen, and I think more and more countries are waking up to the fact that these types of interventions are, you know, this type of activity is very doable. You know, it's not something that requires a huge amount of investment. It doesn't, in many cases, doesn't require a huge amount of reoperating or repooling. It just requires connecting the dots, as it were.
Yeah, connecting the dots. Well, Nils, I really love your work. I have the same opinion. We do not need to skip the biomedical system, but I think you're adding more awareness that there is a bigger picture we have to have awareness of, and you do that also by providing evidence. So that's a very good way. We do not have any more questions. I do not know if there's something you want to add at the end of your lecture, like a take-home message for the audience.
Maybe just to say, I realized that I never, there was only a link up very briefly at the end of the video. You can find these videos at the WHO Europe YouTube channel. So if you type in WHO Europe and YouTube, you'll get to that. And our report is available on our website, which is euro.who.int/en/CCH. So do have a look on that page, and feel free to download the report, which is a hefty one, or to just look at the summary, which outlines some of the main findings.
Thank you very much, Nils. We will watch the video from YouTube. We will download the report, and let's stay connected as All My Moods. And maybe we see you next year on the festival.
Fantastic. Thank you so much for the invitation. It's been a pleasure, and have a lovely evening.
Thank you, Nils. Bye-bye.
Good night.